Hello, my dear doctors. So today I've come with another case for Mrcp basis consultation station, and today I'm going to talk a bit about Marfan syndrome. And this case has appeared in one of the consultation station, so I thought it would be better to make a video about this case. So let's start our case for the consultation station. So this is a case scenario which you will see when you are outside the consultation room. They'll give you a small scenario so you have some idea about the case. So in this case, this is Miss Turner, and she's 25 years old, and she has presented with some joint pains, and there is some history of occasional chest pain, and there is some history of family history. So these are the buzzwords. Once you see these buzzwords, you start thinking about all the differential diagnoses. Try to make a list in your mind that what could be the possible diagnosis. So she's a young lady and she has a joint pain, there's some chest pain, and there's some family history of heart condition. Okay, so let's move on. So once you enter the consultation room or you can enter your station, first of all, you're going to take a detailed history, because this is a consultation station, this is a long station. So first of all, you're going to introduce yourself. Sorry, I missed it here. You're going to introduce yourself. My name is this, and I'm one of the doctors in the hospital, and I'd like to ask you a few questions regarding your complaints. So when the patient gives you consent, so the consent is, first of all, it is very important. Must take the consent first. Okay. And after that, you start by exploring the chief complaints. So begin by exploring the patient reason for the visit. So can you please describe the joint pains? This was her main complaints. And obviously, we want to ask about when does the pain started, and how would you characterize the pain? Was it dull, sharp, or intermittent? I'm sure you know everything about this, just to refresh the memory. Then going to ask about, tell me about your chest pain. And again, the pain, we want to ask about the type of pain, any radiation, any specific triggers, everything. Okay. Then we're going to go in more detail about the pain, when she first noticed the joint pain, and whether it is constant, getting worse, or fluctuating, and more detail about the chest pain, when it begins, and any patterns or factors which are influencing it. We're going to talk a bit more about the location and radiation. So where exactly you feel the joint pain in your knees, and does the pain radiate anywhere else, and also location of a chest pain, where it's localized or does it spread to any other areas. Characteristic of the pain I already mentioned, aggravating and relieving factors. I mean, different, just rehearse yourself it, because in the consultation station, it's better to take as much history as you can, and as should be precise and in a bit detail. So any specific aggravating and relieving and alleviating factors, any associated symptoms like any visual disturbance, eye pain or change in the vision, any shortness of breath, palpitations or fainting spells. So these questions are quite important, because when you are asking this, because the patient do have a family history of some cardiac problem, so it's better to ask these questions. Now remember, in Marfan syndrome, once you enter your station, by looking at the patient, you already have an idea that this patient has Marfan syndrome. But don't get carried away by just looking at the patient and you know the diagnosis that you're going to do very well. You still have to take all the history, and you have to act like, you have to demonstrate that you are able to take a complete history, and you are able to ask all the relevant questions. So we will be obviously concerned about the visual disturbances, and we want to know about any eye pain or any changes in vision. As you know that Marfan syndrome is associated with the dislocation of lens. So let's move on to our history. We got family history. So tell me about your family history, especially concerning heart condition. You mentioned mother had heart surgery. Can you provide more details? Are there any other family members with similar health issues or condition? Personal medical history. Have you ever been diagnosed with any chronic medical conditions or currently taking any medications? Any surgeries or significant medical interventions in the past? We want to know about the patient physical activity level. So can you describe your level of physical activity, including the exercise routines and any strenuous activities? And obviously, in the lifestyle, we want to ask about any smoking and any alcohol history. Psychosocial history, also very important. In any patients who have got some complaints, joint pains, headache, anything, must ask about psychosocial history. So whether it is affecting their daily activities and overall well-being, and we also want about any recent source of any stress or major illness changes recently. So remember that always ask the patient psychosocial history. The patient then maybe give you some of his or her concerns, and that is also important. Then we'll move on to the review of the system. So going to ask about other questions like cover all the symptoms like respiratory we already covered, gastrointestinal, to ask about any diarrhea, any vomitings, how is the appetite, any change in the body weight, neurological, to want to rule out any associated symptoms. So this is a rough idea. Obviously, you can make your own templates, you can do your own, but this is a rough idea how to take the history. So again, I will emphasize that you know the diagnosis already once you see the patient, this is Marfan syndrome, but still try to take the complete history. Moving on to the physical examination, general appearance, you will all be knowing that patient already has a tall stature and there's a arm span exceeding the height. So this is, you just take maybe 30 seconds to just look at the patient from head to toe and ask the patient to extend the arm so that you can see the patient got a arm span which is more than the height. Then you want to do the ocular. You can do this in any order. Through the ocular examination, especially we want to look for any lens dislocation, because it's associated with Marfan syndrome. Sorry, this one is very small picture, but I think you can see some lens dislocation in this. I'll make it a big for you. So here, this is something which will look like. You will see it clearly if there is any lens dislocation. It's better to look for this because it is associated with Marfan syndrome. Okay. In the cardiovascular system, obviously this is a very important system to examine. So remember, in consultation station, although it's considered as a long case, but still do all the relevant examination. So you should put more emphasis on the relevant examination only. So cardiovascular system, auscultations, what we know that it is associated with some MEP, mitral valve prolapse. So we're going to auscultate and look for any positive finding like mid-systolic creak or any systolic murmur at the apex. And if you are able to grade it, it's okay. If you're not able to grade it, just mention the systolic murmur and the click. Just remember that if you're able to pick up, that is enough already. So while you are doing your physical examination of the Marfans, try to get all the positive findings which are present in the patients. So this will help you in the end to present your findings smoothly. In the musculoskeletal system, obviously you want to look for any arachnodactyly, which are the elongated fingers. You want to see for any hyperextension of elbows and knees. And here, on the skin examination, we want to look for any striae or stretch marks on the skin, okay? And skin laxity, it is associated with there will be increased laxity. So here I have shown you some of the examples, and this is called this one is called a risk sign, and this one you can demonstrate in the case of the Marfan syndrome. And here you are looking for the hyperextension. As you can see, there is a hyperextension at the wrist. Okay, hyperextension at wrist, and this is something called thumb sign. This is called thumb sign. So just demonstrate all these signs: wrist sign, thumb sign, and hyperextension, and do it confidently so the examiner knows you know about the what are the features which you have to look for. So then we'll move on to the skeletal examination, and we want to look for any scoliosis or any significant spinal deformity. So you know that Marfan syndrome, it is associated with pectus excavatum or pectus carneatum, anything. So just look at the chest and look at the spine also. It's better to just palpate the spine. And then we will do the joint examination. So hypermobility I already mentioned. So one thing, remember that if the physical examination and the outlook is Marfan syndrome, if there is absence of these signs, like if there is no lens dislocation or no scoliosis, still it does not exclude the diagnosis of Marfan syndrome, because there is a variable expressivity. So the positive findings, they collectively contribute to the overall assessment and suspicion of Marfan syndrome. Okay, so here you already know that this case in Marfan syndrome should be very straightforward, but remember that the differential diagnosis in this case are important, and the examiner may ask you what are your differential diagnoses. And even in your presentation also, when you are presenting a case, you're going to say the Marfan syndrome, it's better to put 2 or 3 differential diagnoses in your presentation, so the examiner knows that you have a wide range of knowledge and thinking about other conditions as well. So what are the Ehlers-Danlos syndrome? That this is one of the differential, and we know it is characterized by joint hypermobility and skin laxity, but there are some specific features which are seen here, and obviously genetic testing can help differentiate between the two. Homocystinuria, this one is a bit close to the Marfan syndrome, because homocystinuria is associated with the tall stature, joint laxity, and maybe some cardiovascular abnormalities. But in this patient, homocystinuria, the distinguishing features include some intellectual disability and different pattern of cardiovascular involvement. Loeys-Dietz syndrome, well, if you can remember it, it's okay. If you don't remember, it doesn't matter. But there is some features which are common with Marfan syndrome, including aortic aneurysm, but it's also associated with some specific craniofacial abnormalities with wide set eyes and arterial tortuosity. So important diagnosis which I will say in the differential, consider these Ehlers-Danlos and homocystinuria. Non-syndromic tall stature, well, this will come quite low down, but still some individual may have a genetic predisposition to tall stature without associated connective tissue abnormalities. Mitral valve prolapse, well, condition usually present mid-systolic, ring systolic murmur similar to Marfan syndrome, but again, Marfan syndrome to have characteristic features. Tall patient, arm span more than the height, patient has high arch palate, patient have arachnodactyly, so all these things. Familial aortic aneurysm, and I've just put it here, but because the patient has a history of family history of cardiac conditions, but again there is absence of musculoskeletal features in this case. Gigantism, acromegaly, well, can lead to tall stature gigantism, but again there is a distinctive features. And skeletal dysplasia, certain skeletal dysplasia may result in abnormal bone growth and stature. But again, there is characteristic morphinoid features here and physiological tall stature in the end. As some individuals, they have met a natural predisposition to tall stature due to genetic and environmental factors. So if you can remember Ehlers-Danlos, homocystinuria, and acromegaly, I think, or gigantism. I must say gigantism. So that one should be enough. But considering that if you obviously, the Marfan syndrome will be obvious. Obviously, mitral valve prolapse is associated with Marfan syndrome. So, if they ask about any other conditions which can cause mitral valve prolapse, we'll be going off the topic. But sometimes they may ask, so you should be able to answer that question as well. So, how are we going to case presentation? So, first of all, going to introduce yourself. In the introduction, you say, "Good morning, good afternoon. Today, I like to present this patient who has referred for evaluation due to concern about whatever is the concern." So remember these templates. It will be very helpful when you have a stress of the examination. So today I'm going to present this patient who has been referred for evaluation. What were the concerns? And the patient presents with whatever the presenting complaints. In this main complaint was the joint pains and a clinical feature raising suspicion for Marfan syndrome. So you can give your diagnosis straight away first, and then you can elaborate it a bit, or you can give it in the end as well. Then we'll move on. This information, patient information, this one I think maybe not needed. If you already mentioned it in your introduction, the patient age, male, female, and this one don't need. Okay, let's move on. History of present illness. The patient, then you will not stop. Remember, when you are in your MRCP PACES examination, just continue with the presentation until the examiner stops you. Okay, so you'll continue with your history of present illness, same like we go through in our final exams. Just continue the same pattern. So patient reports the onset, approximately how long was it? Reports the onset, approximately how long ago, and the symptoms have been whatever it is, whether it is constant, intermittent, worsening, and details on the characteristics of the symptoms. So characteristics of the symptoms, about the quality of the pain, any exacerbating, any relating factors. Mention about the past medical history. If the patient give you any family history, here it is an important family history of some cardiovascular disease. Social history, mention a bit about occupation, and then review of the symptoms. So this is just a briefly, you're going to finish your history, and then you, in the presentation, you will not stop here. You will talk about the general examination. We have already discussed the characteristic features of the Marfan syndrome. Just repeat it. What was the general appearance on the ocular examination? Ocular examination mentioned, these are the important negatives to mention, that there was absence of any ectopia lentis. Cardiovascular examination, you're going to do the cardiovascular examination, and you're going to tell about the positive findings, that there was a mid-systolic click and a systolic murmur. And musculoskeletal, we're going to talk about the arachnodactyly, joint hypermobility, and any abnormalities, if there are any abnormalities in the spine, and increased skin laxity. So same order, you're going to present all your positive findings, and then you will going to give your assessment. So based on the clinical presentation examination finding, there is a suspicion for Marfan syndrome, and the characteristic features include this. However, it is crucial to consider other potential differential, and further investigation, including genetic testing, may be warranted. Okay, and then we're going to give a plan if the patient doesn't solve. So what are the further investigations, about any consultation to the specialist or to the cardiologist, to the genetist, and the patient education. So this one you will, so roughly you divide your presentation, I tell you simply, divide into the history, then you move on to the briefly about the physical examination, and then about your plan. Okay, this way you will be very easy, and it will be very smooth for you. In the plan, we're going to talk about the further investigations, any further consultations, and the patient education. And finally, going to do the closing. If the examiner doesn't stop you here, it doesn't stop you, you move on. In conclusion, this patient's clinical representation raises concerns about Marfan syndrome. So a comprehensive assessment and collaboration with the specialist will be essential for a definite diagnosis and appropriate management. So this is all about the Marfan syndrome. So some of the questions which are usually asked in the Viva, remember the examiner has 5 minutes for this. So now we just try to give very short answers. So can you elaborate on the specific musculoskeletal finding observed in this patient? So this is quite simple. You already have presented it. So patient has arachnodactyly, elongatic figures, joint hypermobility, particularly noticeable in the elbows and knees, and these are consistent with musculoskeletal manifestation of Marfan syndrome. How would you differentiate Marfan syndrome from Ehlers-Danlos syndrome? Well, both syndromes, they involve the joint hypermobility and skin laxity, but Marfan syndrome is distinct and present with specific features like arachnodactyly. Overall clinical presentation, cardiovascular manifestation, and genetic testing can help differentiate between the two. Okay. Then, what are the cardiovascular manifestations commonly associated with Marfan syndrome? So you must know that mitral valve prolapse is one in this patient. The cardiovascular manifestation could be aortic dilatation or aortic dissection. So in this case, auscultation revealed a mid-systolic click and a systolic murmur, so indicated potential valvular involvement. Importance of genetic testing in confirming the diagnosis. Well, a positive genetic result enhance the diagnostic certainty and aid in distinguishing Marfan syndrome from other connective tissue disorders. So are there any genetic conditions that may present with tall stature and joint hypermobility similar to Marfan's? Other non-syndromic tall stature, we already talked about it, and certain skeletal dysplasias. What about the significance of ectopia lentis? Ectopia lentis or lens dislocation is common ocular manifestation of Marfan's, and its absence in this case, however, does not exclude the diagnosis, and it highlights the variability in the expression of the syndrome. And how about the management and education of the patient regarding the suspected Marfan syndrome? So it usually involves a multidisciplinary approach, and we have to collaborate with the geneticists, we have to collaborate with the cardiologist. Briefly about patient education and potential genetic testing, and there is importance of regular follow-ups for the monitoring and management. So that's all about the Marfan syndrome. Hopefully it is helpful to you, and I'll see you in my next presentation.